would totally agree with Shannon. We're seeing now that we've increased our capacity a lot in both in Albuquerque and in other parts of the state, we are no longer seeing a backlog. Um, we certainly have in the past, and we have had issues in the past making sure that we are prioritizing New Mexico patients, which we still try to do. Even though we have capacity, we have the New Mexico Abortion Providers Network, which is generously funded by an anonymous donor who is helping us all get together as a group. And so we have a chat where we can help arrange clinic times for patients, seeing who's got availability for different kinds of complex cases. And I'll just also say that the biggest delays that we're seeing are not our capacity. They're these terrible restrictions that are imposed on our patients. So the travel, the lodging, the fear, the confusion about what the laws mean, are all of the factors that are causing patients to have still very dangerous delays in care, some of which are inconvenient, force women to continue a pregnancy, but many of which are actually quite dangerous to their health.
Can you illustrate, is there any, can you share with us any kind of a story that would illustrate that situation?
Yeah, I mean, so I think all of us that provide second trimester care have been in this scenario where just recently I got a call from a high-risk pregnancy specialist out of state with PPROM. PPROM is something that nobody used to know what that meant. Basically, it means when the bag of waters ruptures spontaneously early in pregnancy. But where there is still a heartbeat. And, when somebody is 5 months or 6 months pregnant and their bag of waters breaks, we know that they're at very high risk of infection. And the standard of care is to offer those patients abortion care. That is one of the big things that changed. And many of the lawsuits that you've probably heard about coming from Texas are women who are suing because they were not allowed to proceed with abortion care because there was still cardiac motion in the fetus. We just had a patient like that. She had been in the hospital for 2 weeks, just being observed because she was not considered to be sick enough to have an abortion, even though it was completely futile for her to continue the pregnancy. She tried to get through to us through their hospital internet, and all of the sites for abortion care in New Mexico were blocked. So she figured that out, was able to through her own data, was able to get through to us. Her doctors told her she shouldn't transfer because of the risk of infection, but they actually wouldn't provide her with care because there was still cardiac motion. So she got in a car with her partner and drove 6 hours to come see us in New Mexico to get the care that she needed. And she literally came sort of just in time. It was an emergency procedure on our part because of the how advanced her infection